In 2008, I used to have 5 members of staff. So I used to work here 24/7 alone. So I was the only clinician working during the day and working at night up to around 10. Then I would retire. If a patient comes in the night, I used to be called back.
So we thought we need a business program that can actually be able to help these providers grow. And really the aim was around sustainability. So we really needed to get people with skill set in business.
We recognize that health providers are business people in their own rights. They run enterprises, and those enterprises need to grow and thrive for them to be there in the long term, to be able to continue providing an essential service to the community. A lot of providers used to work from hand to mouth. They take the day's proceedings and they order drugs, or they pay themselves, they pay employees, and they can't see anything tangible that they're working towards.
I really did not start this with a business perspective in mind. And so I did not even have any very good business structures.
Once we identify the gaps, and then we come up with a very specific business improvement plan for each facility to help the provider be able to grow from one level to the next. We just don't look at the quality or the service delivery in terms of healthcare at the facility. We look at other components within the facility that also enhance the level of quality that the provider is offering.
Things have completely changed because I've employed 4 clinical officers. So we have 4 clinical officers working with me. We have 2 laboratory technologists. We have pharmaceutical technologies. We have nurses. We have cleaners. So things have really changed. It's not the same Ukunda Medical Center like what we were in 2008.
Tunza has great people. They are committed, because if you look at all the guys who are in the business program, most of them have managed, all of them, they have registered their business. They are complying with the government. They have bank accounts. And it's not that we are forcing them. They see sense in it.
I think the biggest exciting part for us now is when we move to the next stage, trying to get our providers to see how much more value can we add and how do we work as partnerships without donor subsidy. That's why we came up with the Tunza Platinum.
We have enjoyed years of bountiful donor financing. And that was important, and I think there was a time and place for that. But things have changed, not just for PS Kenya, but also for the country as a whole. We are becoming more affluent, we are becoming richer, and that's okay, because this financing goes to other people who really need that financing. And so what we did is that we began to question ourselves, how can we be able to make the essential support that we offer within the Tunza social franchise sustainable. And sustainable is getting providers to begin paying for that support. So Tunza Platinum is still a social franchise, but it's a social franchise that runs in a more efficient way, in a more sustainable manner. And what we have done is that we have repackaged a lot of support that we initially offered through the Tunza Family Health Network, and we have repackaged it in a manner that providers can be able to pick from a catalog of support that we will offer.
Initially, we resisted that because we thought free services should continue, but it is completely an unsustainable approach. When we are so many platinum members, PS Kenya is able to provide us as clients to the suppliers on a massive scale. When you do a business of scales, you get better discounts. And so we are going to get our drugs and our supplies at better rates than we were able to do when we were negotiating on our own. If you look at the advantages you are going to get, and you try to match those advantages vis-a-vis the subscription fee, the subscription fee really is nothing.
There was overwhelming reception. They all wanted to be part of this new baby called Tunza Platinum. So we ended up signing 63 providers to be part of the pilot. And then we started to implement a few things that we wanted to implement under Tunza Platinum. So we came up with 4 pillars. The first pillar was automation of the services within the Tunza Platinum members. Then the second pillar was to improve quality of services within the Tunza franchise. And then the third pillar was the marketing. Our people are supposed to know that these things are happening. And the fourth one is to ensure that the medical supplies they use to offer services to their patients are of guaranteed quality. My dream is to have the entire Tunza to be in the Tunza Platinum.